Hello everyone. So now we're going to do the second question for the USMLE free practice CCS questions. This is for step 3. So I'll walk you through how to get there. Remember, these questions are for free. So there will be no copyright restrictions. So first I would recommend you pause this video or first see how to get to the question, access the question, make it on your own, and after that go and see this video and see what I did wrong, what I did right, and yeah, that's about it. So let's search it up. Go into your browser and you could mark his CCS, probably USMLE, step 3, practice cases. Okay, press enter. So after that, go to, here you have several options. Step 3, sample test questions. Yeah, probably this one. Let's go in there. Then we'll see, okay, these questions right here, I've came in here a couple times. So these are more of a multiple choice question samples. So let's search for step 3, sample questions. No, interactive testing experience. I guess it would be there, or right here, computer-based case simulations. No, it's the explanation. So if you want to see the video explanation, look at it right there. This would be the second CCS case I am doing with my practice and studying. So that's why, as you can see, I have no idea where I'm going into. So we're gonna find that out right here, maybe right here. So interactive testing experience. Yeah, it's right here. So go through all of this, but right now we're going to see the second CCS case. I did this one in a previous video, my first case. This is my second case, and let's get at it. Accept the cookies and enable timer, and let's see what happens. Okay, maximum time 20 minutes, so 18 minutes plus 2 minutes. Start case. Let's see what happens. Gonna read it with you guys. 32-year-old woman comes to the office because of increasing pain and swelling of her knees during the past week. She is well developed, well nourished, and in no apparent distress. So she is in her fertile years. She has knee pain, which is bilateral. It's not small articular pain. It's a large joint pain, and it has been ongoing for the past week. Okay. Now let's see the second window, which will give you the vital signs. She is a febrile, normal pulse, respiratory rate normal, normal pressure, and normal BMI. Yeah, okay. Let's go on to the third screen. So she's stable, vital signs are okay. Now, history of present illness. The patient, a 32-year-old woman, has experienced increasing fatigue and generalized weakness during the past 4 months. So 4 months of constitutional symptoms and 1 week of actual joint pain of her knees. During the past 8 weeks, the patient has had generalized aches and joint stiffness, most notably when she gets out of bed in the morning. Just based out of this is rheumatoid arthritis. The stiffness lasts 1 to 2 hours and makes it difficult to send the older children off to school. She also has had pain and intermittent swelling of the wrist and hands for approximately 4 weeks. We were expecting that. She rates the pain as 5 out of 10. Her knees have been swollen for the past 5 days. The pain and stiffness of her joints interfere with caring for her family. Acetaminophen provides minimal pain relief to a 4, so just 1. It reduced the pain from 5 to 4 out of 10. No fever, night sweats, and the patient has no known infection exposure. So this doesn't seem as septic arthritis. This doesn't seem like lupus. She has experienced decreased libido for 4 months. Okay, we're not sure what that will mean in this context yet, but let's keep on reading. Childbirth at ages 31, 26, and 22, no problems. She's on oral contraceptives, vaccinations up to date, family history. Father, age 57, has hypertension, mother, type 2 diabetes, social history, married with 3 children, active with spouse, okay, sexual history, okay, she is African American. This might be important, doesn't seem so right now. Personal habits, does not smoke or drink alcoholic beverages, uses other medication. Occupational, small business owner, sings in church choir, and likes bacon. Review of symptoms, everything seems negative. Negative gravity at 3, para 3, menarche at 12, regular withdrawal, bleeding 1 week ago, everything is normal. Okay, so what do we want to do? First of all, we aren't interested in passing her any place. We're at the office. Let's leave her at the office. Don't believe we have to change the scenario to not intensive care, not the home, emergency part, nor inpatient. So let's stay at the office. I would like to, she has the oral contraceptive order sheet. Let's add something here. Let's add an order. Let's make this smaller. You can't see it. I'm gonna then mark order. We're gonna ask for labs. Acetaminophen isn't working, so yeah, I would give her, what's the best therapy for rheumatoid arthritis? We're talking about methotrexate, but we're not given that yet. We want to see a CBC, complete blood count. We want to see a rheumatoid factor. We want to see a cyclic citrullinated peptide. What's this? I didn't ask for a break. We want to see what else. Is she pregnant? Because we're given methotrexate. So beta HCG. We want to see her kidney functions, and that's in the complete basic metabolic panel. And do you want an x-ray? Okay, an x-ray. Let's go for it. X-ray, and that's about it. Let's see. Confirm orders. We could send her home. We already have. We could give her a little NSAIDs while we have this, but let's see what happens. Now we have CBC with differential. Confirm. I want it once. Rheumatoid factor. CCP. Beta serum quantitative. No, I want it in the urine qualitative. Yeah. And BMP, basic metabolic panel. That's it. Okay, X-ray. Doesn't seem, it's bilateral. Do I really want an X-ray? Is it worth it? Not sure. Don't think so, right? She has no signs of infection whatsoever. This might harm her. It might subtract points from my test. I'm not going to send the X-ray right now. Okay, cancel. That's it. What else? I already asked for that. Now what should I do? Obtain results, probably. We're at the office, so I can send her home, or let's give her something for the pain. Ibuprofen, maybe? Let's see. Let's see what happens. Confirm orders. Oral. Continuous. No, one time. It doesn't give me the chance to give it every X amount of hours, so it's not continuous, because one time, or let's see what happens. Let's check it out. PO, day 1. Okay, let's see. And it won't harm her. She has no specific risk factors. Let's send her home and see her back later. We can see her in a couple days. Let's send her home. Let's see what happened. Change location. Schedule appointment. I like this. Let's schedule an appointment Do we need a chest x-ray? We're gonna send in methotrexate. Don't think so. Something is calling me to send a chest x-ray. It's not lupus, but constitutional symptoms. African American with articular pain. Could this be sarcoidosis? Let's send her an x-ray before we cancel move. Chest x-ray. Order x-ray. We don't want arthrocentesis right now. Chest x-ray, confirm orders just once and send her home. Office, office, sending her home. Change location, schedule appointment. Let's see her. Could be a month from now, but actually let's see her in a week and see what happens. In a week, 8 days, reevaluate case within next. Okay, let's see it like that. Appointment will be okay. Confirm move. I guess I could have checked her vital signs before she left, but she was looking pretty well. Okay, so beta HCG negative. Advance the clock, day 1. I'm still on day 1. Okay, let's continue on day 1. We have leukocytes 8,000. I'm 8,000. Erythrocytes. She is anemic. That's interesting. That's okay. But we could see this in rheumatoid arthritis, but wouldn't be the usual thing. So anemic, platelets 300,000 normal. All the rest is normal. Segmented, yet 56%. 4 bands. It's still in the normal range, but interesting. And normocytic, normochromic, leukocytes and platelets normal in number and morphology. Okay, so she has some constitutional symptoms. She has changes in her CBC. She has changes in. She has 3 criteria. She's missing. Remember that lupus mnemonic is something or pain. We don't know the skin. If she has something on the skin, let's see what else we have right here. Okay, creatinine normal. Okay, let's go in order. This looks normal. Glucose. Creatinine normal. Okay, we already saw that here. Creatinine is normal. Okay. PA view normal cardiac impressions, normal findings. Continue. But we're waiting. Yeah, we're waiting for the rheumatoid factor. 1 in 160. Normal is 1/40. So this is positive. Okay. Continue. Let's go see what else we have. CCP, which is highly specific for rheumatoid arthritis, is strongly positive. If this is strongly positive on your test, it's rheumatoid arthritis. They won't be making you this won't be positive, and then the diagnosis would be lupus. So this is rheumatoid arthritis. In the real life, you could sometimes have some doubt, but this is highly specific. Okay, so let's see what else we have. The patient's stiffness is less severe. She rates the pain as a 4 on 10 point scale. I could have gone seeing her a little more. Let's see, advance the clock. Or stop now. I want to see how her, what could we give her? Oral contraceptives, yeah, she can keep using them. No contraindication. Let's get one of these. Let's see. Lymph nodes, yeah. Chest, lungs, neuros. No, I don't want to. History, interval follow. Let's see what happens with this. Okay.
Well, it's it. Send it to?
It says she is in less pain, so I just wasted some time there. We already got that information, and I'm sending her home. She's home. So when is she coming back? We don't know. Obtain results or see patient later. I want to see her. Reevaluate case. Okay, we already know that she has rheumatoid arthritis. We already saw the labs. So now we could give her methotrexate. It's less severe, but it's active. Methotrexate. She has anemia, but we don't have to treat that anemia right now. Methotrexate. One time continuous oral for a week, and see her in a week. I'd see her in a week and then de-escalate. So let's see. Office. Let's see her again. Let's see what happens if we mark this schedule an appointment. I'll see her in 2 weeks. Yeah, no break. Okay. Schedule appointment. Current time day 4. We'll see her in day 18. And ibuprofen. Okay. Okay, I would give her ibuprofen maybe, but let's leave it like this and see what happens. The appointment must be greater than the current time. Okay, so a month. 1, 2, 3, 4. A month. Let's go for a month. Confirm move. The patient noticed much improvement in the stiffness and joint pain since beginning the medication. She rates the pain 3 out of 10. We're doing good. Okay, so now let's suspend the methotrexate or not. Interesting, right? Can we use NSAIDs? Let's use NSAIDs. No. NSAIDs. This is interesting. NSAIDs. Let's see what happens if I mark NSAID right there. To order, may I please type the... Okay, ibuprofen is okay. Let's go with ibuprofen. Ibuprofen. Let's send this continuous oral. You order more than once. Can't order it again. Okay, so what are we going to do right now? Diclofenac. Shows a little anemic. I think this one is, well, continuous oral. Okay. And let's see her in a week. Home. Or let's see how her extremities are, interval. Let's see what happens. The patient, much improvement. She rates, we already saw this, so I'm wasting time on that. And let's see what else. Office, change location, or no, let's see patient later. Call see me as needed. The screen real time on the next screen, finalize care. Deleting orders you can cancel now. Adding orders to be done now. Adding our current condition. Okay, so we already gave diclofenac as needed. Can we? Okay, let's leave it like that. But it should be as needed. So let's write new orders. NSAIDs. No, as needed. Okay, so here we could refer to rheumatology. Rheumatology consult Now later. Later, I don't care. I'm not interested in that right now. But okay, later. Rheumatoid arthritis. Right orders. What's this name? Council. And let's see. Council. NSAID use, maybe. So, council live in asthma, cancer, contraceptive, drive, EpiPen, exercise. It's important that she exercises. No smoking, okay. On methotrexate, she's not on methotrexate, so she can. Okay. I don't know. What else? Okay. That's it. Time is expiring. That's it. End block. And that's it. So now let's go see what's the feedback. Start, take a break. Time remaining, 17 elapsed. I'm not sure how much time I had on this case. So let's go see. Next block is the feedback. Okay, here we have it. So let's see it larger. In evaluating case performance, the domains of diagnosis, including physical exam and appropriate diagnostic test, therapy, monitoring, blah, blah. In this case, 32-year-old woman comes to the office due to knee pain. From the chief complaint, the differential is broad. It includes osteoarthritis, infectious, rheumatoid, systemic lupus, gout, blah, blah. This patient has experienced fatigue and generalized weakness during the past 4 months. The developed generalized aches and morning stiffness during the past 8 weeks, and more recently, pain and intermittent swelling of both wrists and proximal metacarpophalangeal joints, this one right here, as well as bilateral knee swelling. Remember, osteoarthritis is more right here. Distal, this one, rheumatoid arthritis, is more proximal. Highly suggestive of a chronic systemic inflammatory process. Physical shows bilateral swollen, warm and tender proximal metacarpophalangeal and knee joints. Other physical findings unremarkable, seems consistent with rheumatoid arthritis. While the presence, okay. Further diagnostic evaluation is appropriate to confirm the diagnosis and establish the severity. Computer-based simulation database contains thousands of possible tests, therefore it is not feasible to list every action, blah, blah, blah. The optimal efficient approach to diagnose would include performing an appropriate physical examination. So I didn't even perform the physical examination. I just read the HPI and didn't even mark the physical examination. So this is on my second case. Always, you should remember to ask for a physical exam. I thought it was already included in the HPI, but no, you have to choose it. So probably I lost some points there. The anti-CCP, we asked for it, and we also asked for a CBC. Arthrocentesis with relevant synovial fluid studies. I wouldn't ask. Tell me what you would do in the comment section below. Would you ask for an arthrocentesis? It's an invasive procedure. If it was bilateral, symmetric, and all the findings for rheumatoid arthritis, would it actually add something in your diagnosis, or would it be more harmful to the patient? Anti-nuclear antibody assay, yeah, you could send it if you were thinking of lupus, but I wasn't thinking about it. Not necessary, but okay. It wouldn't harm the patient. I do agree with that. Erythrocyte sedimentation rate and C-reactive protein, that talks to us about activity as well. So that was a good idea. Could be used. And also, yeah, important. These tests serve to assess the severity, okay, and exclude SLE, gout, infectious process, or reactive arthritis. In addition, joint x-rays would provide a baseline assessment. Yeah, so the x-rays would be okay because you could have a baseline to compare afterwards, because with rheumatoid arthritis you could have these changes that happen. I think it's called like what's the name, teacup, or don't remember the name. The thing is that the edges of the articulation get eroded, so it would be okay to have a baseline. I didn't get the x-rays because I thought that the diagnosis was enough and we had to treat it, but maybe I was too simplistic in my approach. In adult patients, optimal approach, it would focus on relieving pain. Okay, we did that. We decreased inflammation, prevented or slowed joint damage. That was with methotrexate, and improving function. Okay, well done. Let's see if we sent the appropriate medications. Optimal treatment, combination of NSAID and corticosteroid with a DMARD. I used the DMARD with NSAID. The DMARD was methotrexate. Here we have it. Slow joint damage and improves. Okay, to prevent deformity and loss of function, should be advised to exercise appropriately. I told you guys, but I didn't have time to write the order. It's because I don't know what I should have written. Maybe counsel exercise. But that's the importance of doing these exercise, these practice questions, so you get familiarized with the application. In this case simulation, when NSAID or corticosteroid is initiated, the patient regularly reports both joint and systemic improvements. Ordering a rheumatology consult or additional monitoring is appropriate but optional during the time frame of this simulation. Okay, so it won't harm the patient, but it's not necessary if the patient is actually improving. And if you think it through in real life, you probably wouldn't be doing cost-effective measures if the patient improved and is doing fine. I believe that would be better for the United States medical system, and they would love you for not sending patients to 20 different consults if unnecessary. Some additional tests and treatments that could be ordered, but neither useful nor harmful. Yeah, so you could screen this patient because she's she's sexually active. You could screen her for sexually transmitted diseases, or you could also send more specific lupus tests. I wouldn't send it because if the screening test isn't even necessary, the anti-nuclear antibody, I wouldn't go to this length. But at least blood work probably wouldn't be a problem, wouldn't harm the patient. Thyroid test, urinalysis, uric acid. Examples of suboptimal management. Okay, so this is things that would delay diagnosis, treatment, or treat with things that don't work. Treatment with salicylates would also be considered suboptimal. Although they would temporarily relieve pain, there are other agents with fewer adverse effects. Of course, you don't want to give this patient high doses of aspirin if it's not such a good anti-inflammatory as other NSAIDs. Poor management is things that actually would just fail and make things the opposite for the patient. So here you have arthroscopy or synovial biopsy. Actually, maybe arthrocentesis could go here. What do you think? Let me know in the comment section. And yeah, that's it for this case. See you in the next one. Let me know what you think in the comment section.